What epilepsy drug interactions should I avoid? When managing epilepsy with anti-seizure medications, it is important to know which drug interactions to avoid. These interactions can either reduce the effectiveness of your treatment or lead to harmful side effects. Let's explore some key interactions that you should be aware of. First, certain medications can make anti-seizure drugs less effective. For instance, carbamazepine can reduce the effectiveness of hormonal contraceptives. This could lead to unintended pregnancy, so it is crucial to discuss birth control options with your healthcare provider. Additionally, some antibiotics may interfere with phenobarbital, which can decrease its ability to control seizures. Next, combinations of anti-seizure medications can also pose risks. For example, taking valproic acid with lamotrigine can increase the risk of serious skin rashes. This requires careful monitoring by your doctor to ensure your safety. Another area to consider is how anti-seizure medications can affect other drugs you may be taking. Carbamazepine can reduce the effectiveness of blood thinners like warfarin, which may increase the risk of clotting. It is essential to inform your healthcare provider about all medications you are taking to avoid these interactions. Pharmacokinetic interactions are also important. Many anti-seizure medications are metabolized by liver enzymes. If you take other medications that induce or inhibit these enzymes, it can change the blood levels of your anti-seizure medication. This can either increase toxicity or reduce seizure control. Older anti-seizure medications like phenytoin and phenobarbital tend to have more interactions compared to newer drugs, which usually have fewer issues. You should also be cautious with herbal supplements and vitamins. For example, St. John's wort can reduce the absorption of phenytoin, making it less effective. Other herbs like ginkgo and kava, as well as supplements like biotin, calcium, and vitamin D, may also interact with anti-seizure medications. Phenytoin can lower folate levels, which is particularly important during pregnancy, and vitamin K supplementation might be necessary to prevent deficiencies in newborns. Alcohol is another substance to be mindful of. It can worsen the side effects of anti-seizure medications, such as sedation and dizziness. This increases the risk of falls or accidents. Alcohol can also alter how these medications are metabolized, affecting their effectiveness or toxicity. For instance, combining alcohol with perampanel can worsen psychiatric symptoms, including aggression and mood changes. To manage these risks effectively, always inform your healthcare providers about all medications, supplements, and herbal products you are taking. Avoid alcohol or discuss its use with your doctor, as it can interact dangerously with anti-seizure medications. Be cautious with starting or stopping any medication, as this can affect your seizure control. Using trusted drug interaction checkers or consulting pharmacists can help you review potential interactions. Regular monitoring by healthcare professionals is essential to adjust dosages and ensure safe, effective treatment. In summary, avoiding drug interactions in epilepsy treatment requires careful management of anti-seizure medications alongside other medications, supplements, and lifestyle factors like alcohol use. Close communication with your healthcare providers is vital to prevent reduced seizure control or harmful side effects.